in order for us to take the scans that we need to make our measurements on the forces in Kendall's mouth, what we'd like to do is we'd like to have Kendall make 4 different movements with her jaw in order to be able to get the kind of information that we want from our scan onto the computer. So the first thing that we're going to do is we're going to coach Kendall in those movements, and we will do this every time we're with a patient, regardless of how much they know about what we're doing or how much they don't. And we're going to use very specific words like close hard on your back teeth, or close hard and hold the way you normally close together. I almost never use the word bite, because if I say the word bite, the patient has a tendency to protrude a little bit like they're biting off toast or a sandwich. I want them to close hard on their back teeth the way they normally fit. So in coaching Kendall, there are 4 different movements that we're going to make. The first one that we're going to do is what we call a habitual force bite. That habitual force bite is a close, hard, and hold, open, chomp, 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 open, close, hard, and hold. So let's have Kendall practice that for us. Let's have you tilt your head into its normal posture. You probably noticed her tilting her head back just a little bit too much. I'm going to come back on top of her head to make sure she stays in her normal posture. I'm going to have you open, close, hard, and hold, open, chomp, 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 open, close, hard, and hold. All right, Kendall, that was really good. I want to make sure in between every one of her quick chomps is a reflex opening. So I want you to be a little bit more deliberate about opening. It doesn't have to be real big, but I want you to be deliberate about your opening in between each of your chomps. Okay? All right, head position. Okay, open, close, hard, and hold, open, chomp, 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 open, close, hard, and hold, and open. That's what we call our habitual force pattern. That's going to give us our screening that we need to be able to determine whether or not Kendall has dysfunction present in her chewing system related to her teeth, her muscles, and her joints as we do our initial dental force analysis on the forces in her mouth. So at this point, I would go ahead and take that scan for her. Open, soft with your lips, sneaking in, resting up against the teeth. Put your head into its normal posture, slightly open, close, hard, and hold, open, chomp, 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 open, close, hard, and hold, open. As I'm going to take this scan for her, I use the little red record button as I would on a DVD or a camcorder or your video camera on your phone. The red button starts the scan and the red button stops the scan, just like making a movie. The next scan is going to be pretty easy for Kendall because it's the exact same movement that we did before, except we're just going to do one. So I'm going to have Kendall be in position. I'm going to have you slightly open. All right, now when I tell you to, I'd like you to open a little bit more, close, hard, and hold, and open. So this is just simply an MIP, or maximum intercuspal position scan. It's a single closure scan, and we use this when we're going to be doing our dental force management or changes to the occlusion as we go along. We need to have a single movie that shows the closure time and the balance when the patient's fully closed. And this is our first scan that we're going to do for any adjustments that we might make. So let's just show how that scan's taken. Much like the first scan, I'm going to position the sensor in her mouth. I'm going to hold that up against her teeth on her occlusal plane. I always have the patient slightly open before we do any scans. So Kendall, I'm going to have you slightly open, close, hard, and hold, and open. And then I stop the scan. This will give us our single closure scan of Kendall. The next 2 scans are motion scans. These are motion scans that put Kendall into her maximum intercuspal position and then slide her jaw over to the left, over onto what would be normal lateral or canine guidance onto that side. And then we'll do the same thing on the right side, and we'll slide over to the other side. Now, when we do these scans, these lateral motion scans, we need to train the patient to make this movement because it's a motion that they almost never make. So I'm going to have you close hard and hold on your back teeth and show it to me. And then scrape your teeth across to the side and open. And that's going to be scan number 1 for the left. And I'm going to have you center your jaw, close, open. I'm going to have you close hard and hold and scrape your teeth over to the other side and open. Okay, that was awesome. Now what Kendall did for us that time was she scraped her teeth back to the exact same side. That happens all the time. That's normal. Patients will do that a lot. So I'm going to say, okay, let's have you open. Let's close hard and hold and scrape your teeth back over to the other side this time. Over, 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 and open. You'll notice that that was more of a challenge for her to do. This movement is something that patients never do naturally, and so it's incumbent on us to make sure that we coach them forward into doing this. So I'm going to try that again. I'll have you open, close hard and hold, scrape your jaw over to the other side, and open. Fantastic. Now center, touch, open, close hard and hold. Now let's go back to the first side again and open. Fantastic. You'll notice that I almost never say left and right, but I say let's scrape over to one side and then scrape over to the other side. Those are 2 separate scans, and we give the patient opportunity to swallow and breathe and recenter their jaw in between each of those scans. All right, are you ready to take those scans? Yeah. Okay, good. I press the red button on my handle to get a new scan up on the screen. I orient my sensor again on her occlusal plane. With her head in its normal posture, I have her slightly open, close hard and hold, scrape to the side, and open. Very good. So that's a scan in and of itself. We just do one at a time. And then I'll press the button again to get a new scan. I'll center, I'll reset back onto the occlusal plane. I'll have Kendall slightly open, record, close hard and hold, and scrape to the other side now. And open. Fantastic. How did that feel?
Strange.
Strange. It's not a normal movement for our patients. All right, so that gives you an idea of how we do our single closure movie for adjustments of balance and closure time, and how we do our left and right lateral scans for doing our adjustments regarding disclusion time and canine guidance. The purpose of those lateral scans, of course, is for us to make any changes that would be part of her chewing system, not just part of her normal activity of swallowing or closing her teeth all the way together. It's not, in other words, it's not a static scan, but a dynamic motion scan of the patient's chewing system. Thank you.